All right, let's go ahead and begin. Good afternoon, everyone. Thank you so much for joining us. For our webinar today, I'm happy to welcome you to the fifth webinar in the series of webinars that we've been hosting that are titled Environmental Health Data Webinar Series. My name is Reem Tariq. I'm a Senior Project Coordinator at the National Environmental Health Association, where I manage projects that focus on federally unregulated drinking water, climate and health, as well as some emergency preparedness projects. As part of this webinar series, I just want to let you know that NEHA has been working in partnership with the Virginia Department of Health on how to use environmental health data to make data-driven decisions. Our webinar today is titled Standardizing Private Well Data. This presentation will provide an overview on how Gaston County set out to standardize private domestic well data. And within this webinar, we'll talk about how Gaston County is developing various standardized and improved methods to estimating the number of private wells, as well as its distribution within the county, and determining risk of contaminant exposure to private well users through some of the spatial analysis work. Our speaker today is Samantha Dye. Samantha is the administrator over the environmental health section of the Public Health Division at Gaston County Department of Health. She oversees on-site wastewater and well section and the food and lodging section in environmental health. Samantha is from Saltville, Virginia, and received her Bachelor of Arts in Biology, as well as a Bachelor of Science in Environmental Health and her Master's of Science in Environmental Health from East Tennessee State University in Johnson City, Tennessee. She began her career in '99 at the former Gaston County Health Department as an environmental health specialist in on-site wastewater and well section. She served as the program supervisor for on-site wastewater and wells preparedness coordinator, as well as the environmental health assistant administrator. Before I turn it over to Sam, I just want to point out a few housekeeping items. Just want to let you know that this webinar is being recorded. The recording to the webinar will be made available about 2 weeks after this webinar is complete, and it will be placed on NEHA's website, as well as the VDH Train learning management system. As far as the Q&A, just know that we will be taking questions towards the end, but if you do have any questions, feel free to insert them into the Q&A box at any point, and we'll address those after Samantha's presentation. Lastly, there will be a survey towards the end of the webinar. Please do take the survey because it does help us in planning for future webinars. And with that, I will turn it over to Sam.
Thanks, Reem. Like Reem said, I work for Gaston County, and that's where our project area is concentrated on. Can you see it, Reem?
Yep.
Okay, just making sure. First of all, I want to start off by acknowledging that we did receive funding for this project. We've received funding from CDC, the Cooperative Agreement for the Safe Watch Program. That was from 2015 to 2020. We're currently in our third year for another 5-year grant cycle with CDC, and it's strengthening environmental health capacities. We've also received funding from NEHA. We've collaborated with CDC and with the University of North Carolina at Charlotte, specifically the Departments of Geography and Health Science and the Department of Public Health Sciences. We've also collaborated with NEHA. A little bit of background about Gaston County. Gaston County is one of 100 counties in the state of North Carolina. North Carolina is a decentralized state, and it has actually 85 health departments. We do have some that are district health departments. Gaston County is the 11th largest county based on the population size. It covers 365 square miles, and we've had a private well ordinance in effect since 1989. We were one of the first few counties to actually have a private well ordinance. It wasn't until 2008 that all counties in the state were required to have a well program. We know that we've issued over 8,000 private well permits. Unfortunately, we have thousands more that were installed prior to 1989 that we don't have data for. We definitely have some water quality concerns. We've been limited in predicting or responding to our threats due to the capacity, such as the number of staff. All of our documents were paper documents, and just the lack of data in a usable format. Nothing was electronic, unfortunately. Some of the known risks that we do have, we have elevated arsenic levels. We do have 2 very huge coal ash ponds within the county. The state has come in and actually sampled wells around the coal ash ponds, and they have found vanadium, hexavalent, and chromium. It's just a couple of contaminants been found. We have numerous leaking underground storage tank sites, and we at one time had 7 Superfund sites. We still have 4 active Superfund sites. This is just a map kind of showing, this is from the North Carolina Department of Environmental Quality. It's a well permit decision tool. What we actually do is go to this website, and you can see it's got numerous sites on here. The yellow and black ones, they're actually underground storage tanks sites. The green ones are above ground storage tank sites. If you can see some of the little triangles, that's inactive hazardous waste sites. So you can see we've got quite a few sources of contamination. What we have to do is we actually have to give the citizen a copy of this. We zoom into their actual property and give them a copy of this with a 100-foot radius around it so that they can be informed to know what type of contamination is in the area. This is one of the reasons why we are trying to go electronic or went electronic. This is one of our well permits from back in 1989, or excuse me, 1998. You will see that it's all handwritten, hand-drawn. It's starting to fade. So this is just one of the many reasons we needed to do something different with our documents. So what we did is we're working with the University of North Carolina at Charlotte, like I said, and we actually came up with a database design. We had students to scan in all of our documents. From there, they did the data entry from all of these documents. They actually cross-checked them. And then we had a PhD student who actually geocoded all of the documents or all of the addresses for the well locations. He did that down to street level. As part of this project, like I said, the UNCC students scanned them. They actually scanned the applications. They scanned the water sample data, well construction data, the actual permit itself. They scanned over 8,512 permits. They did this in teams of 2 so that they could cross-check all the data entries. There was such a large amount of data. They actually went back and cross-checked this twice just to be sure. We were able to geocode all the addresses for 98% of the well locations, and they were able to complete this from September 2016 to March 2017. This is a map kind of showing where all the wells that have been geocoded. You can see where all the wells are, the little black dots. And you'll notice here in the center, there's not that many wells located there. That is actually the city of Gastonia, which is our largest municipality. So that's why you see them, don't see as many there. Next, after we did the office work with the geocoding and everything, we moved on to field work. We hired UNCC students, undergraduate and graduate. We trained them to use handheld tablets that had GPS units and the database software that we needed. They actually went out in teams of 2 to various residents that we had the permits for, and they administered private well owner survey to try to help identify any reasons why a citizen might test their well or might not test their well, what types of barriers they may have to getting their well water tested. We also had to teach the students how to collect bacteria and inorganic water samples. We offered those samples for free, just hoping that they would let us take the GPS points and actually take the survey. Some of the results from the field work, all residents that were visited, and they did go to all the well permits that we had, that we could geolocate the 98%. Every house was visited. If they weren't home or if they didn't want to participate, we did leave them with well and septic brochures to try to provide some educational materials to them. We did provide real world experience to 74 undergraduate and graduate students over the course of this project. They actually collected 2,100 samples for coliform and E. coli and inorganic. Like I said, all of these were for free. It was determined that we had 571 water samples collected that were positive for total coliform, and we had 31 which was positive for E. coli. I really feel like the E. coli ones, looking back at the data, those were older wells, and those were mainly bored wells. We did have 72 wells that came back that had elevated arsenic levels. This is just a map kind of showing where the coliform bacteria in the wells was located. The darker is the ones that were actually tested positive. White areas, those were actually negative tests. And like Reem said, we wanted to estimate how many people are actually using private wells in the county, because we do not have a true knowledge of that at this point. So we had to make some assumptions. We assumed that there were no private wells within the municipal boundaries. We assumed that each housing unit has a private well and not sharing a well with a neighbor. So we used the existing data that we have with all of our permits from 1989. We also used the 2019 US Census data. So we created a spreadsheet with that, telling us the total population of each city and town. We've also used the North Carolina Drinking Water Watch website. This is actually a public water supply systems website that anybody can access. It actually has data on all the community wells throughout the county. It gives you the well name, the number of wells that's in that development, any sort of sampling information they have, violations. Luckily, it also provides you with the number of connections and with the population being served. So that was very helpful. There were 10 out of 133 community wells that were actually within the municipal boundaries. So basically, we wanted to find out the total population. These are some of the resources that we used. And this is just a table showing the number of estimated housing units from the 2019 census for each municipality. And then it's showing the population for each of the municipalities. So inside city limits, we had over 139,000 people. This is showing the total population on private wells. Like I said before, we took the 2019 census, got the total. We looked at the number of folks inside city limits to determine the number that was outside. Also using the community well data, we were able to determine the number of citizens that were on a community well. So we wound up with 65,701 people that were actually using private drinking water wells. And the number of total housing units that we have, once again, we looked at those inside and outside the city and determined that there was 29,251 housing units that are on private wells. We also wanted to try to determine the testing distribution. So what we had to make some assumptions that private well owners are more likely to accept a free water sample as opposed to paying a fee. Also, that the majority of requested private well samples were due to a real estate transaction, and that private well owners tend to only request water samples when there is a problem that occurs, such as odor, staining of fixtures, or some sort of unexplained health problem. We also have an environmental health software that we use called custom data processing. It allows us to do ad hoc reporting. So we were able to determine the number of water samples that were paid from the time period of 2015 to 2019. This also lists the ones that were required as well as the ones that were requested. We really didn't have a way of distinguishing the two. So we ended up having to go and just kind of do a manual count. We determined that there was 1,616 water samples requested during that time period. Sometimes they would only request bacteria. Other times they would request both bacteria and inorganic, just depended on what their need was. So to further try to determine our distribution of sampling, we divided the county into east and west. We've got a major thoroughfare that actually splits the county in half. And so we were able to review the number of water samples based on the zip codes where they were collected. We determined our eastern side of the county is more affluent. It's got lots of development, higher land values, a lot of lake properties. And on the west side, that is much more rural, lower socioeconomic, and less developed section of the county. Almost twice the number of private wells were sampled on the east side. So that goes back into validating our assumptions that water samples are requested for real estate transactions and for new wells. We also reviewed the existing database to try to tell us what types of contaminants are of concern. Three of the ones that we actually picked out was arsenic, bacteria, and iron. We chose the bacteria because we did have so many samples come back positive for total coliform. We chose iron because it is the, not necessarily health concerns, but it's the most aesthetically concerning contaminant with the different types of staining that it causes. We actually have to do what's called a health risk evaluation. We've been doing these since 2008. It is a requirement from the state. So that allows us to give the residents an evaluation, tells them what's above allowable limits based on EPA standards. These are all recommendations since there are no standards associated with private drinking water wells. This is just a kind of a guideline for them to go by. It allows us to give them information of possible health concerns and also provide them with information on treatment units they can purchase. This is a map of the iron issues that we have in the county. Of course, the darker is the ones that have more iron in them. These are actually ones that are above the North Carolina recommended allowance of 2.5 milligrams per liter. So we do have quite a few of those. And then the lighter color, the kind of the light tan here, those are between 0.3 and 2.5 milligrams per liter. So it's actually above the recommended EPA standards for iron. Also from 2015 to 2019, we were able to detect 25 water samples with arsenic levels above 0.01 milligrams per liter, which is the EPA standard again. All of these were detected in the northwestern quadrant of the county. We know this is a natural occurring source because we do have the Kings Mountain geological belt that goes through that area, and then it is known to contain arsenic. Back in 2001, we did a sample project where we did 4 square miles and we sampled 150 wells, and 1/3 of those did contain arsenic. We also did another water quality study that showed from 2011 to 2019, looking at the data, that there was a 50% chance wells in the northwestern section of the county would contain arsenic at or above the 0.01 milligrams per liter level. Here's a map showing the arsenic across the county. And as you can see, it is in our northwestern quadrant. Like I said, the Kings Mountain belt does run through here. We've had quite a few. The darkest colors are the ones that are definitely above the allowable limit. The next shade, lighter brown, that's ones that's at 0.005 to 0.01 milligrams per liter of arsenic. We've had challenges and opportunities from these projects that we've been able to work on. We lacked personnel capable of performing statistical analysis on the data and correctly interpreting it. We've also had, we don't have the personnel that had GPS or mapping skills to be able to look at it from that standpoint and do some spatial analysis. The project, however, did allow us to review existing data on wells and see where samples were being requested. We also realized that we needed to track and differentiate between the required water samples from the new wells and also requested water samples. There was no way for us to tell if it was a real estate transaction or not. So those are things that we changed to try to better know in the future. Is it somebody that really just curious to test to know what's in their well? Or are they testing for a real estate transaction only? So that will allow us to maybe target the populations that are not testing as much, so we can get better information out to them. Our next phase is we've hired an environmental health data analyst. He actually started Monday, so we're excited about that. He's got his GIS skills, and so we're really looking forward to having him on board so that we can make better data-driven decisions. We look to change our private well ordinance after we get this data analyzed to make it more stringent and focus on the areas that we need to. We also, all of our environmental health specialists in our on-site wastewater and well program, they're currently learning to use GPS units with sub-meter accuracy to collect data points. So they'll be collecting a data point for the wells when they go issue the permit, go back out to sample the well. And starting in October of this year, we will begin issuing electronic well and septic permits. So we will be able to GPS our auger borings and also the well location. And then when they do the final installation, we will be able to electronically collect that data and make that available. And that's it. Does anybody have any questions?
Sorry, I was on mute. Thanks, Sam. Thank you for that wonderful presentation. I just want to remind folks, if you have any questions, please do put those into the Q&A box. If you'd like to ask a question out loud, what you can do is go ahead and click on that raise your hand feature, and I can go ahead and unmute you, and that way you can ask your question out loud. Let's give folks maybe a minute to put in their thoughts into the Q&A box. I believe the chat feature should also be enabled. So if you want to put in your questions via chat, that should be fine as well. All right. Looks like we've got one question from Nicholas. He's asking, did you have any information on private well treatment systems?
We do have some that the state has provided us. So we're actually using their documentation to try to help well owners determine which type of treatment system would be best for them.
Thank you. All right. Any other questions for Sam? Sam, I guess I'm wondering, I've got a question for you. I know you mentioned pretty early on in your presentation regarding some of the collaborations that you were involved in, also alluded to some of the funding that you've received to do this work, but I'm wondering, what is Gaston County's perspective on sort of maintaining some of the work that you folks have done long term? How is that going to be done? Any thoughts on that with regards to, maintaining the maps, keeping them current? Any thoughts on that?
Well, that's why we've hired the data analyst. That is a grant funded position till 2025. We're hoping that we can maintain that position to help us keep up to date with the maps and the data analysis. And I think it looks good that we would be able to do that. That's going to be our best bet to try to maintain this. Otherwise, we'll have to dedicate one of our staff to start doing that. And right now we're limited on staff.
That's fair.
And that's one of the reasons we want to go electronic with everything, to make it easier to where we can actually, eventually we're going to have the well locations and well information on the Gaston County GIS website. It'll tell them the location, the well driller's name, the depth of their well, that sort of information.
Dan has asked, were the university students paid?
Yes, they were. The grants allowed us to be able to pay them.
Great.
We actually ended up hiring 2 of the students when they graduated. They enjoyed the work. One of them actually didn't have enough science hours to come to work for us, and she actually went to a community college to get those science hours. So
Nice.
It's definitely been a win-win situation for us.
Wonderful. All right. Right. Looks like we've got one more question from Nicholas regarding, are there any privacy concerns from local well owners about having these well locations publicly available?
There is not that I've been made aware of or anything. I know other counties throughout the state have something similar to this, to where they have the data accessible. We will not publish the water sample data just because we don't want to open that up to where if they're trying to sell their property, then somebody looks at the data. It is available. It is on the North Carolina state website, because we do send our inorganic samples to the state lab. It's just harder to try to find it, but it is a matter of public record.
Great, thank you. All right. I think those are all the questions we've got. I want to thank Sam for taking the time to present on this topic, and I want to thank everyone who's attended and engaged for this webinar. Just want to remind folks that as soon as you do exit the webinar, there will be a survey that will pop up. Please do take that survey, because it does help in planning for future webinars. And with that, I want to thank everybody for participating in this webinar series. And thanks again, Sam. Appreciate it.
You're welcome. Thank you.
Bye-bye.
Bye.